Welcome to our Mock Interview Pro series. Today, we're focusing on a critical role in the healthcare industry, the discharge planner. If you're preparing for an interview in this field, you're in the right place. Let's dive in with our first question, which is all about teamwork and collaboration. Can you share an experience where you worked closely with a healthcare team to create a discharge plan? This question helps interviewers understand your ability to collaborate effectively within a team to achieve the best outcomes for patients. To tackle this question successfully, keep these tips in mind. Talk about a specific patient case you were involved with. Describe the roles of each team member and their contributions. Walk through the steps you took to develop the discharge plan. Mention any challenges you faced and how you overcame them. Wrap up with the positive outcome for the patient. Now, let's look at how you might structure your answer.
In my role in the rehab unit, I worked on a discharge plan for an elderly patient recovering from surgery. Together with the nurse, social worker, and physical therapist, we assessed her needs. We coordinated home health services and arranged necessary follow-ups. The biggest challenge was ensuring her home was safe for her return, which we addressed by scheduling a safety evaluation. The patient was able to return home safely and continue her recovery with confidence.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for Discharge Planner. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Describe a challenging case you handled and how you managed the issues related to the discharge process. Interviewers want to see your problem-solving skills and how you manage complex situations. Here's how you can approach this question. Choose a specific case that presented clear challenges. Explain the patient's situation and the obstacles you faced. Detail the steps you took to address these issues. Highlight how you worked with the healthcare team and outside services. Conclude with the outcome and any lessons you learned. Here's an example to illustrate how you might respond.
In one case, a patient with complex needs faced delays due to lack of home care. I coordinated with the care team to develop a discharge plan that included setting up in-home assistance and connecting with local resources. This ensured a smooth transition and successful recovery at home.
How have you communicated discharge plans to patients and their families effectively? This question assesses your communication skills and ability to ensure understanding and adherence to care plans. When answering, consider these strategies. Use clear and simple language to explain medical terms. Engage patients and families by asking open-ended questions. Provide written materials that summarize the discharge plan. Encourage patients to express their concerns and ask questions. Follow up to ensure they understand and adhere to the plan. Let's see how this can come together in a response.
In my previous role, I explained the discharge plan in simple terms and provided a printed summary that they could refer back to. I also encouraged them to ask questions to ensure they understood everything.
If a patient insists on leaving the hospital against medical advice, how would you address their concerns? This question examines your decision-making skills and ability to handle sensitive situations. Consider these steps when formulating your answer. Listen carefully to the patient's reasons for wanting to leave. Provide them with clear information about the risks of leaving. Explore possible solutions to address their concerns. Involve family members or support systems if appropriate. Document the conversation and the patient's decision. Here's how you might frame your approach.
I would first listen to the patient's reasons for wanting to leave, ensuring they feel heard. Then, I would explain the potential risks involved in leaving against medical advice, providing them with detailed information. Next, I would work with them to find solutions, like a follow-up appointment or home care options, to help alleviate their concerns.
How do you prioritize discharge planning for multiple patients with varying needs at the end of your shift? This question evaluates your ability to manage time and priorities in a dynamic environment. Here's how you can tackle this question effectively. Assess each patient's readiness for discharge based on clinical criteria and support needs. Identify patients who have a higher risk of readmission and prioritize them. Utilize a checklist to ensure all necessary discharge tasks are completed. Communicate with the healthcare team to address any outstanding issues. Document all discharge plans clearly to ensure continuity of care. Let's look at a sample answer to guide your response.
I would start by reviewing each patient's chart to determine their readiness for discharge, focusing on those with complex needs and high readmission risks. I'd use a checklist to track tasks and collaborate with my colleagues to resolve any outstanding issues before I leave.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free. Just grab it below.